Auditor General indicated that nearly a third of ambulances are non-functional. Hospitals remain under-equipped, and both urban and rural patients are often left waiting for hours for urgent care. In life-threatening situations, these delays can be fatal. Now remember, this is a conversation that I did have some time last year with a company called Aura. Now, this is where we find ourselves again. Of last year, we were talking about a general state of affairs in terms of emergency response services in the Kenyan economy from a wider perspective. We hadn't really put it down to ground, and even by then, the government hadn't really come up and told us exactly where we are as a country. Now, the office of the Auditor General is talking to us this morning. Now, what Aura is doing essentially is putting this into proper perspective. Remember, when we were talking about this particular conversation, we were looking at it from a general perspective. Now, Aura now is addressing this particular issue from this perspective. Whatever they're saying is that they can actually come in, help these county governments to reduce this emergency response delays that the Auditor General is talking about in this particular report, so that about a streamlined response in its emergency services. And this morning, what Aura is doing, it is acting as a coordination layer and connects individuals in emergencies to the nearest available private or independent medical responses. Now, for those who didn't listen to me last year, now what the platform does is that it bypasses administrative delays and grounded county fleets by using real-time location data, responder availability, and a 24-hour control center to dispatch and track help instantly. All right, this morning, I also do have Victor there, the same man that I spoke to last year about exactly what Aura was trying to do. We were trying to look at where we are as local numbers pertains and where international numbers pertain.
Good to speak with you again.
Good to speak to you again.
Happy New Year.
You know what? Last year, when you and I were speaking about this particular issue, we were generally looking at where we were as a country compared to other places where these emergency response services were working correctly. But let me just point you out what the Auditor General has spoken about this. This is what they're saying, that ambulances are non-functional, hospitals remain under-equipped, and both urban and rural patients are often left waiting hours for urgent care. And so they're saying, in life-threatening situations, this is just the words for the Auditor General, these delays can be fatal. I mean, let's go back and look at this word after word. I'll go back and take you to what they're talking about. Here they're talking about non-functional. How bad can that be for a county government, Victor?
Yeah, absolutely. Those are very dire stats, as you may see, and a lot needs to be done. So as you've seen in the entire universal healthcare coverage chain, a lot of things are broken. We've come a long way, but then there's still a much longer way to go. And this will call in a lot of collaboration and effort, both from the national and county governments to private players as well. When you look at the ambulances themselves, so I do understand that county governments would essentially own these assets and then use revenues and funds that are generated from within the government coffers to make sure that these services are up and running. What we've seen over the past couple of years is they've been, haggling between the national government and the county of funds and allocation of funds. So essentially what that means then is that access to critical resources is then affected, right? So these county governments essentially will not have funds to service their vehicles, probably pay members of staff, and then the trickle-down effect then will mean that the more common mwananchi will not be able to get access to timely emergency response services.
Yes.
And essentially this is where our flags came, not only from a technological standpoint, but also from the inherent model in which Aura operates in, whereby we do aggregate both private and public emergency response services into one holistic nationwide platform that we're then able to dispense access to these emergency services. So looking at some of the clients that we have with sort of a nationwide outreach and outlook, we're then able to dispense these emergency services way faster than if a county government or probably the national government would have had. And this is where now that synergy and that close collaboration between private players and the government comes in. Like I said before, we've done something, but then we have a much longer way to go in terms of making sure that access to critical emergency services is extended to not only the elite few who are able to access the very well-equipped hospitals and very expensive medical ambulance services, but then to the common mwananchi who essentially does not have access to these services at a fingertip. Any life loss is something that we do not want, and that is why now private players like us are coming to play and plug into this whole ecosystem and infrastructure to make sure that we're able to dispense this service to
like I said, Victor, I'm going to take you step by step because we're going to look at this particular report, just handle those areas that the Auditor General has actually pointed out in it. Talking about the other issue here, they're saying that even those that have these services, they are under-equipped. Let's talk about that. From an Aura perspective, I mean, you have somebody telling you, yes, we do have some of those services, but we are under-equipped. How do you come in to bolster this under-equipment that majority of these county governments, especially these hospitals and county governments, are facing?
Well, how I look at it, this calls for partnership, really, in partnership from across, different divides. Like I said, private players, governments, NGOs, to mention just but a few. So what we've seen is that we have different players like NGOs, for instance, who are then able to donate or equip county government with different facets system. So you'd find different players taking care of the technological aspect of it. Others will then take care of equipping the ambulances and making sure that they're at least able to run for a couple of years. We would have other players who will come in from a point of capacity building and trainings, right? Because in as much as we'd want these ambulances and the hospitals to be well equipped to handle these emergencies, we also want the staff and the human resource handling these emergencies to be well trained for the emergencies that they're going to be dealing with. So it's a closed circuit and a very collaborative environment that the healthcare players in the country and in the region needs to look keenly at and also explore ways in which we are able to complement one another given the different strengths that we bring on board. Like for instance, Aura brings on board a very rich product perspective, product in the sense that we have a very superior technology from panic to resolution to the end user. And in handling an actual real emergency, the coordination between call it a call center or a command center and the response units on the ground and the actual end user and the facilities is well coordinated through one very unified platform. So these are stronghold, and this is something that we've extended not only to Kenya, but then of course originated from South Africa, where we first started, and expanded into different countries and different jurisdictions, not only in Africa but globally, in Europe and in the United States. So Depending on the strength that different players bring on board, we then approach a holistic and a collaborative kind of framework to make sure that whatever it is that we bring on board, we'll then work to make sure that we address some of the gaps that we're currently seeing in the market.
Let's go to the last part of that warning by the Auditor General report. This is what the report says, that in most of the situations, both urban and rural patients are left waiting hours for urgent care. And then she completes that report by saying, in life-threatening situations, these delays can be fatal. You know what? You and I was speaking about minutes last year. We were saying, well, I mean, emergency response should be brought down to minutes. But then the Auditor General is saying, we are not still in minutes, wherever we are. In fact, we're still talking about hours in this country, from the time that you call for emergency response to the time that it arrives. Victor, how bad is it that it's 2026 and county governments are saying, in this country, regardless of where you are, whether you find yourself in an urban area or in a rural area, you gotta wait for hours for emergency response to arrive to you. How bad are we doing as a country?
Yeah, like I said from the beginning, situation that we want to be in as a country,
yes,
especially given the direction that we are looking at, right? We are pretty much a big player in this region. You know, the biggest economy in, you know, just listening to the CS Treasury just the other day saying that we're the biggest economy in East and Central Africa. So it goes a long way to tell you that we are pretty much trailblazers and trendsetters in the region. And one of the areas that we, of course, want to you know, like be industry leaders, which I mean we currently are, is on access to these emergency services. All right, and like I said, it's not where we were before. You know, we've made significant progress, right? As you may know, the government was looking at rolling out nationwide a panic-based infrastructure whereby a user could get. So these are some of the strides that the national government has undertaken, and you know, actually gone ahead to engage different stakeholders and actually funded, and you know, it's a process that we are currently in. It's not where we want to be, but then there's a long way for us to go, and this calls for a holistic view of how we want to overhaul this healthcare infrastructure and the healthcare ecosystem. Different players bring different strengths on board, and like I said, everybody that is in this space has something that they bring to the table, yes, right? And in areas where there's a failure, then there has to be a fallback mechanism, right? And that is the space that Oracle plays in. There has to be a fallback mechanism, right? And that is the space that Oracle currently plays in, whereby in the instances where there's failure on the national or the county governments, then are we able to do that in our own capacities as private players? We are now able to aggregate all this network, and through our partners, through our distributors, we're able to get users are able to get access to these services. So if, for instance, you are an insurance company, for example, and your insurance company has taken up the product, then as a private citizen, you're able to get access to our services in a private capacity, since it has already been extended to you through insurance provider. And these are some of the ways in which you're coming in to plug in some of the gaps that you're seeing. Like I said, so many data points collected, a lot of things and trends and patterns that we've seen, but then it's a better place than where we were a couple of years ago. But then again, the journey to global standards is still a very long way to go, and our anticipation is that we should be there through the support of the government, both national and county government, and all the that then we are able to realize some of these dreams and give our Kenyans access to decent healthcare that they fully deserve, and as you may know, currently paying for through SHA.
Good. Victor, can you hear me?
Yes, Naga.
Fantastic.
Yes,
so
Naga.
let me cross over to this area that that you've just addressed, the fragmentation of the existing technology and emergency services. That's what you want to come in and level that playing field, where you're saying that all these fragments that are currently existing in this country, they don't need to exist, that we can come in and help you levelize that playing field. How bad is this fragmentation in this country, in the fields or in the areas that you've tried to establish this tech? How bad is this fragmentation you're talking about here?
Yes, it's not as good. The picture is not good, and that's the thing that we're trying to address, right? In that every player in their own space, you have your own fleet of emergency response vehicles. You operate in your own silo and in your own individual capacity. But then what then we do is that we say, how best can we make use of that asset that you have? Because the vehicle in itself is an asset, and the crew inside those vehicles are assets. So how best do we make efficient use of a capacity that you may have in a day, in a week, or in a month? And you find that aggregating the idle capacity that is currently there ends up to a lot of time, in weeks, if you look at it in the context of weeks compared to months. And that's what we're saying. If you come on Aura, we're then able to aggregate you and have you empaneled on our network. Of course, after having gone through the necessary checks and background screening that we do before empaneling any provider, and then you say, by the fact that you are empaneled on Aura, you then have access to a wider pool of clients that you're then able to serve, right? So if your reach was only Nairobi County, for instance, right? So here all of a sudden you have reach and access to clients in other counties, all right? So Kiambu County, Kisumu County, Nyeri County, and what have you. So just borrowing that and mirroring that to the fragmentation that you're talking about. Capacity, individual capacities will operate inside those, but then now all of a sudden we will now bring you to sort of a nationwide kind of outreach, and you are able to monetize the idle capacity that you may have through working with Aura and through working with the partnerships and distribution partners that we currently have, to make sure that you're able to not only take care of your capital costs and paying for salaries and all, but then also just making sure that you're able to earn a living from the resources that you have at your disposal while saving lives at it.
Pretty much. Victor, so I hear you speak. Are you saying that in this country, it's not that we don't have availability of these services here that we're talking about, that what is needed and what you're trying to do as Aura is come in and sort of introduce a proper coordination in terms of how they're supposed to operate? Is that what your tech is going to enable us achieve as an
Simba? And this is now where we leverage on technology to make sure that we try to bring efficiency into this space as much as possible. Not only efficiency, but also visibility, right? So from a national perspective or a county government perspective, you're able to map out where all these different resources are, and you're able to see how far out these resources are from a location of panic, from an emergency. You're then able to map out different zones, or hotspots where you'd essentially expect to find incidences. And then now, based on this, you're able to, using the data that you shall have collected, you're then able to predict in a way, take and position your fleet a way that make sure that they are as efficient as possible, and also reduces your response times as possible, and make sure that we get life-saving help to users as quickly as possible and in the most efficient way.
Pretty much. I know how counties can start to use your product, and how even companies that are listening to you this morning, like insurance companies, can start using your product. We'll speak to that in the second part of this conversation. But I want us to, before we go on a break and come back and talk about that, I want you to speak to me directly from where you're sitting this morning. I mean, you're in the implementation phase in this country. That's when you're telling county governments, you're telling insurance companies that this is what you can do, and you're telling private players as well, listen, what, we have a product for you that you can actually onboard and start being a critical player in this field through this product that we're giving you. When you look at the data that you're seated with right here today as we speak in 2026, and compare it with the data that I know you're exposed to from when you were implementing this product in South Africa, can you speak to that? Can you confidently say, yes, it's a product that we introduced to majority, joined by what we have now, majority of Kenyans are opening themselves up to Aura as a proper product that's going to streamline this field?
Pretty much, Simba, and very spot on. There's definitely an increased appetite in our product and in our services, given the fact that it's able to be embedded in your everyday products. So I know we've talked about insurance products and insurance services, but then it can pretty much be embedded into your day-to-day kind of consumer-facing products or applications.
Yes.
And whichever way or shape or form you interact with the business, for instance, right? So it could be your it could be M-Pesa, for example, right? So through an embedding, this could be extended to you as Simba, right? It could be a product where, Netflix subscription, right? Through that subscription, the product could be offered and extended to you, right? So that's the level of granularity that distributed in the product can get into people's hands. And since last year, from the last time you and I were in the studio and just discussing about the outlook of the landscape, there's been an increased appetite from businesses wanting to take up the solution and position it differently to how their users interact with them as a business. And from our outlook for the year, we're only seeing this going up.
Yes.
We're only seeing the appetite going higher.
Yes.
Access to emergency services is no longer a nice to have, but a must have.
Yes.
And I think businesses and organizations are realizing that this is actually the case, and they want to jump on the bandwagon as soon as possible and have it offered to their users and their clients and their employees, so to speak, before it's too late. Because it gives them that extra edge, it gives them that extra advantage to show that the value that you're bringing on board, either as an employee, as a user, as a client, or whichever way, shape, or form.
Pretty much. I know we have a minute to go for this break, but I don't want to eat so much into that data that you have. If you want to classify the early adopters in this country under the businesses that you're targeting in the country, who would you say is leading in adopting this product, Victor?
Yeah, that's a good point. So for us, Uber has been, a key and critical player for us,
yes,
not only in the Kenyan market, but in the other markets like South Africa, Uganda, Ghana. Uber has played a critical role in letting people know that access to service is a must-have, we said, and not a nice-to-have. And Uber realized this pretty much on in their live evolution, and realized that it's a service and that's. So I'm pretty sure you've taken an Uber before, and there's usually an SOS or a panic button that in case either you or your driver needs access to emergency services, and not only ambulance services, we are talking about security emergencies. In cases where you feel like your life is in danger, somebody's following you, you're in an unsafe place, then you're able to request for security help. So we partnered with security response partners who are able to offer this service, and also roadside assist services, right?
Yes.
In case your car stalls in an unsafe place, then you're able to get access to towing services, and this gives users that peace of mind that I know that even if anything happens to me, then there's somebody I can call, right? You wouldn't want to call your friend at 2 a.m. in the night, but then again, through some of the distributions that we currently have, you're able to get access to immediate response services And some of the early adopters, like Uber, for example, that we're just speaking of now in terms of context, have realized this early on, and we're already seeing other players and other providers also kind of embedding the same solution in their own different ways and their own different unique offerings. And the value has been there. I know Uber is currently considered, one of the most safest, one of the safer, rather, ride-hailing applications in the country. And these solutions, what Aura brings on board is partly due to why this positioning is so.
Pretty much. Guess what? We are still with Victor this morning, talking about why you need to understand this tech product called Aura in the Kenyan market. And what Aura is saying, that there is no need as to why you should wait for hours and hours for you to get an emergency response, whatever kind it's gotta be. So, country, and why that Auditor's General report, it's a damning report really when you look at these numbers this morning, saying that in this country, it's either those services are unavailable in the county governments, or for those that are available, there is a massive delay, or if it's there, then it's not enough. You're told, wait for it to get there. Once we come back from this tiny breather, we'll be looking at what institutions can actually start opening themselves up to this product. And even if you open up yourself to this product, then what journey is Aura going to take you through as you also become an adopter of this life-changing product in the country? Kenya doesn't need hours for emergency response. That is what Aura is talking to us about this morning. Once we come back, still with Victor.
Taarifa zinapochipuka na kutufikia papa hapa kwenye makao makuu ya chumba cha habari cha runinga ya Lookup, kwenye taifa, kwenye serikali, kwenye bunge, tunajitosa hadi kwenye sauti ya wenyeji ili kupata tu maoni ya wenyeji kuhusu masuala haya yanayochipuka.
Maana hii kitu inaenda kuumiza Mkenya kwa tax.
Hakuna kitu tunafurahia. Nothing. Absolutely nothing.
Sisi tunaumia, si ati tunaumia ile ya kiukweli. Juu maisha ni ngumu.
Na bila shaka tunapata maoni yao ili sauti yao ipate kusikika. Na watasema hili, waseme lile, watasema hiki na waseme kile, almuradi sauti yao ipate taa.
Mambo ya mafuta tena imekuwa ni changamoto zaidi kwa kila mtu, kwa bodaboda.
Uchumi ikikuwa stable, tunaamini mambo
boda, mama mboga nini. Hao sasa ndio wamefinywa zaidi mazuri.
Mtazamaji, hii ni bunge la wenyeji.
Welcome back to the Morning Drift. We are still talking about Aura, an emergency response product that you as an institution, you as a Kenyan, you gotta know. Especially if you are in the business of taking care of your clients in this country, in whatever sphere you think about it, either security, either health. You are, you have to think about how safe these guys are in case of emergencies. Now we're talking about the Auditor's General report. It's a recent one that says in this country, if you get an emergency, then you should be praying to God. They're saying that you will sit there and wait for hours and hours before that response comes to you. Number two, and they're giving you the reasons. It's either number one, your county government, where you find yourself. And by the way, it also talks about cities in this country, urban areas. They're saying, regardless of where you are, whether you're in an urban center, whether you find yourself in the rural center, this report summarizes it. It doesn't care. You're you're going to wait for hours before you get that emergency response. And they're also saying in places where these ambulances and those guys who can respond to you available, they are completely under-equipped to help you. So they might be there, and they're telling you, wait, we got to wait for this and this to arrive. And your life, your businesses, and your employees in whatever sense at risk. But Aura is saying, we can make it easier. It's only that these companies in the country have to think about a way to work with us. And so this morning we are still with Victor talking about this. So Victor, let's keep on chipping this cake this morning for any other person listening to you to understand. Now, I want you to speak to insurance companies. The insurance company listening to you this morning, in what form and sense are you working with insurance companies? Because when I'm talking about it, I'm saying insurance companies are the ones that can start benefiting directly from this particular product. Let's speak to them, then later on we can speak to employees and then speak to individuals on how they can also start to get onto this product. Let's first begin. Insurance companies, how can they work with you?
Some questions. Already working with some of the big insurance companies and big brands currently in the country. And what you're seeing is that insurance companies are then able to embed our product and services into insurance policies. Essentially, what that means then is that a user who has an active policy, say with insurance company X, is able to, so long as the insurance policy is active, they're able to get access to these life-saving interventions and life-saving services through Aura, but then extended through the insurance company, insurance provider. So a good example would be, Simba, you have a life insurance, for example, with insurance company X. I won't go to names here. But then since you have an active policy currently running for the year 2026-2027, that is already extended to you through this insurance provider, then depending on how the service is through an API integration into existing tech infrastructure and tech products from that insurance company, like a mobile application, for example, or through just a phone call, you're then able to get access to these services for a year or for so long as your cover is active. So these are the ways that we are seeing insurance product companies embedding our services and getting the product and the services available to their clients and their users countrywide. And like I said, we do not only work with the insurance companies. Yes. We are industry and sector agnostic, which pretty much means that we're able to extend the same solution to fit each and every business vertical and use case. So we are talking about employee value service, for example. So if you're a business or a company with X number of employees, 500,000 maybe, currently have value-added services that they extend to clients, to their employees. They're then able to extend these emergency response services to the employees, who also are then able to then extend it to their dependents. So I think this is also another critical factor that I think I should mention at this juncture. Yes. So by the virtue of you being covered by, say, your insurance company or your employer or whichever business it is that is fronting the product or a solution to you, then the same benefit could also be extended to a number of your dependents, your spouse, your brother, your mom, your sister, your son, your daughter, right? So different ways through which we are able to get to mass market. And that's why we look at, the business side, right? So we're able to get the critical mass market by working with businesses, by working with strategic partners and strategic distributors to make sure that we're able to embed the solution in every day to market and take it to the mass market and everybody to use and get access to these services.
That's it. That's pretty clear then. I mean, you're saying that it doesn't matter what industry you find yourself in or whatever sector you find yourself in, you can tailor this product so that it encompasses everybody, because emergency response doesn't doesn't care where you are, isn't it? Pretty much.
Spot on.
Now, let's make it easier for somebody who's a player in this industry, just like we said in the first part of our conversation, and they're listening to this morning and saying, well, I mean, Aura is promising to streamline this particular industry in this country, and I'm a player in this particular industry. How can I get to work with Aura, and in what way can I get to work with Aura? Can you make them understand easily, take them through the process that if you are a player in this industry, then what in as regards Aura?
Absolutely, a good question. Absolutely, a good question. Three different service types that you're currently operational in. That's security response services. So you're a security response provider, yes, or a medical response company. So in this case, you have an ambulance, you have a team of fast responders, or roadside assist. So here you have either tow truck, or you are into you're able to help users to jumpstart their cars, probably help to change their tires. So here we're talking garages, we are talking different strategic partners along different corridors. Assuming you are along the Nairobi-Mombasa highway, and you are a garage that offers some of these roadside assist services, then just go to our website, submit a very simple and short request, interest expression of interest to work with us. We are going to receive the same, get back to you almost immediately, and then we'll go through the process. Supplier provider, once we've gone through the different vetting processes, because we only work with vetted partners, right? So for instance, like for security providers, you need to be PISRA compliant, IRA compliant, right? So this is the regulatory body that oversees private security in the country, right? For ambulances, your ambulance need to be equipped, right, with different things that we look at and look for in the ambulances. Your staff working in the ambulances should hold the prerequisite training certifications from relevant bodies, right? So if you're a nurse, you need to have a valid nursing certificate from the Nursing Council of Kenya, and so many things. So there's a whole background check but that we need to go through, and then once that is done, we then equip you with all the resources that you need, and we plug you into our network and tell you now start setting lives, because we do on a day-to-day basis. We are their lives.
Yes. Yeah. But here's the thing. Aura is not just promising a service, it's promising a time service. All you're saying is that report by the Auditor General doesn't need to exist in this country. We don't need to talk about hours when it comes to emergency response. All we're talking about is going to be minutes. That's what you're promising for every other person to say, yes, I actually do need that service. So the question then that follows that is, how do you make this service not a partner service, Victor, but an Aura service? How do you make sure that what you're presenting on paper for any other client who's going to work with you, regardless of who your partners are, that whatever you promises on paper is what they're actually translating on the ground?
Yeah. Look, that's also another very big question, Simba. And the reason why we do the partnership route is because it's very expensive, is because of the cost, right? So for you to kind of like hail an ambulance right now, you're going to be slapped with a very, 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 very hefty bill, right?
I can attest that out of experience.
Exactly, right? So what working with partners and distributors gives us, like think about banks, for example, is the scale. And with scale, we're then able to reduce the net cost per user, looking at it globally, right? Because not only do these services need to be fronted to the common mwananchi, but then it needs to be done so at an cost that is very reasonable. So we ask ourselves, what's one of the ways through which we're able to do that, right? Let's leverage on businesses, right? Let's leverage on scale. What is able to give us scale? Businesses, partners. So if you're an insurance company, this again, just I'm about to say, that have hundreds of thousands of clients, right? So if the solution is taken up by the insurance company, the insurance outlet, then what that means is that the effective cost per user is going to be significantly lower, as opposed to if an individual user would, come to Aura directly, which, as you may know, won't happen, because again, we are looking at the cost aspect of it, and also how we're able to get it at scale, so that we are able to do the distribution at scale and make sure that the cost is efficient and makes sense also at scale.
That's it, pretty much.
Yep.
But I gotta ask you this question even as we go on with our conversation this morning. Here's the thing: when it comes to urban centers, and especially in Nairobi, the Auditor General is saying, "Wow, you gotta wait for hours." Victor, from where you're sitting this morning, what should be? You're gonna give me an Aura answer this morning. I'll ask you that. What should be the average for a capital city like Nairobi, especially when it comes to an emergency response?
Look, honestly, if you ask me, I'd say less than 2 minutes. Because you're able to get a pizza delivered to you faster than what we're currently experiencing.
It's actually true. Whatever you're saying is true. You can get food delivered at a shorter period than emergency response.
It should be as quick as possible, right? And for us, the benchmark is: are we seeing the numbers going down month in, day in, day out, week in, week out, and month in, month out, right? So of course, there's some challenges that we need to address, and some of them cut across different bodies and sit within different powers in different jurisdictions. For instance, we do not have the best address systems in Kenya, all right? So that also plays a critical role in get to you, and that is where now players like Aura comes in and try to bridge that gap. So for example, looking at it and comparing how a manual or the quote-unquote kawaida process or normal process would look like, is that for you to get an ambulance, you go on Google ambulance service near me. Okay, you get search results, get some numbers, call. So when you get connected to someone, they tell you, first of all, it's X amount, and then tell you, we'll be there in 10, 15 minutes, simply because you're in Westlands, but then this company or this provider is primarily based somewhere on the other side of town, right? Because since you've Googled and this is the only person that you've gotten access to, it means that you're already connected with them and they're already making their way to you. So it will take time. They have to beat traffic, they have to beat all these other things that come with it. And then there's also this culture where Kenyans for quite a while. And I've seen Kenyans just don't want to give way to some of these emergency service vehicles, or if they do it so reluctant, it is during the rush hour, so there's really no enough space to kind of maneuver. So these are some of the logistical things that we need to address. So now just getting that and marrying that to within the context of what it is that we do at Aura, is that since we are able to pinpoint your exact GPS location, right? So that's how users are able to consume and get access to our services. So we're able to pinpoint the exact location. And then what our system then automatically does is that it immediately starts pinging the nearest available responders within a certain ETA relative to where you are. So what that means is that you're connected to the nearest available responder who is well equipped and well trained to handle your emergency, and a responder that is available. So right now, on the other side of town, we are sending you someone who's a little bit closer to where you are, right? Because we have your exact GPS location, and we do have like generic locations, like I'm on Ngong Road as an example, or I'm in Westlands, right? I mean, that's a very vague explanation. So for us to again bridge that even further, and given the fact that you get your exact GPS location, we are able to know exactly where you are. So we are able to immediately navigate to where you are without even asking you where you are, because we know where you are.
Yeah,
right?
Pretty much.
So this is now where now the power of technology comes in, the power of aggregating emergency service providers in our network comes in, and effectively we are able to reduce this response time significantly compared to the other kind of call them manual processes that are currently there, and we're looking to sort of address.
Here's the thing that we've got to talk about, Victor. Even when we get to see some of these reports that are coming from the Office of the Auditor General, earmarking what county governments are doing in their respective juries, one thing really stands out. It's just legislation, because all of a sudden now some parts of this service have been devolved to some extent, and we do have county governments also, handling a certain percentage of the health docket, and that's where you come in. Could you talk to me about legislation? Is it easier for you to talk to county governments today as Oren saying, you know what, you need us, or you need to make it easier for us to get these people who are working in your counties so we can onboard them onto this project, because one way or another, we are also helping you deliver this service in these county governments. Does it become a bit easier, or is when they're waking up to the reality of, yes, we don't have to do it by ourselves, or I can come in and actually make it easier?
So, of course, we are seeing a lot of openness and willingness from these government bodies to come and are open to just understanding what the product and what the solution and how we are able to add value to their constituents and within their local jurisdictions. But then I also do agree with you that we still have a long way to go as far as our legislation is concerned.
Yes.
We need to make, again, like I said, a lot has been done, but then a lot still needs to be done. And the good thing is that we are an economy that is still growing, an economy that is still learning. We learn from best practices and what we've seen work in other markets, and then kind of just tweak and modify that work within our Kenyan jurisdiction and area of
That's it.
area. So this again goes back to what I was saying, like collaborative approach from all players who are involved to essentially get this product and access to emergency response services to the common mwananchi. It does not matter which docket you sit in, right? So if you're in the private sector and you're in this space, there's something that can be done, right? So if you're in legislature, right, lobby, create laws that are able to make sure that, the common mwananchi can get access to these services as quickly as possible, because it's a basic human need, right?
Yeah.
We don't want to live lives for things that can easily be solved and addressed. Right. So if it's the county government, if it's the national government, we are talking about a disbursement of funds, releasing funds, so these are some of the things that collaboratively all the players in the ecosystem can collaboratively work together. And you're already seeing a lot of strides and a lot of progress being made in the space, because a lot of things happen behind the scenes in different bodies, different ways in which we're able to make the system to work, right? And like I said, it's not going to be a perfect solution. We're not going to get it right immediately. It's going to take an iteration. It's going to take learnings. But then ultimately, it's all about willingness from the different stakeholders to just make sure that this thing works.
That's it. As we get close to the end of this conversation, from where you seated this morning, could you tell us what your projections are, in the sense of, your client list is already completely mapped out. Here we are talking about county governments, we're talking about government institutions, private institutions. What are your realistic projections for this in terms of this product adoption?
Yeah, so what we are seeing, again, the outlook for the year looks very promising. Promising in the sense that we are seeing businesses and partners wanting to take up the product and take it to users. So the progress has been immense.
Yeah.
Use cases are also there and very varied and it's a cocktail of use cases that we also see. So what is currently happening is that we're seeing more and more people wanting to take up the product. We're seeing more and more people realizing that, you know what, in case of an emergency, you don't need to be calling Simba at ungodly hour, right? Let me just call my partner. Let me get access to this service. So if it's an insurance company, for example, I can just call my insurance partner and know that, you know what, I'll get access to and I'll get help almost immediately, right? If it's a banking partner, for example, if you bank with Bank X, you know that in case of an emergency, not only do I bank with you, but and you secure my funds, you secure my account, you secure my future, right? But then you're also able to secure my data, right? But then you're also able to secure my life, right? You're able to take care of me. So this is the kind of mindset different providers and different distributors that you're working with, and we only see more this product getting in the hands of more and more people, and hopefully by the next time that you and I will be sitting and having a chat, then you're going to see how far that has grown.
Pretty much. Guess what? Even as we talk about the companies that you're targeting, your clientele profile, at the end of the day, we're also looking at the end user, this single person who's actually interacting with your product. You know what? Last time you and I was speaking, Victor, we said, in the US, 911 is like a walking stick. Every other person knows that should you get into any trouble, just call 911, and in just a couple of minutes, you're going to get response. Aura has to target that kind of outlook in the country. If every other person is going to be talking about Aura, from a tech perspective, could you talk to me about that? Technology making it easier for the end users then to have this product in their pockets or in their homes and saying, well, yes, my insurance company is working with Aura. Now, because of that, I have this to make it easier for Aura to respond to me.
Yeah. So what we're seeing, Simba, is there's the internet penetration in the country is currently working in our favor a lot, because the solution is internet based. You need to have some sort of connection for us to be able to get your location, for us to be able to handle all this. You're able to see the supply of the response partner proceeding or navigating to your location. All this is internet based. So one thing that really works in our favor compared to some of the markets in our region is the level of internet penetration. We also have a very youthful population. A population that can easily take up technology, new trends, and are willing and ready to try product and services. That there are different ways through which different users would want to get access to this service and to actually consume the product and the service. So we ask ourselves as a business, it's our duty to make sure that our product and how the product is consumed in terms of the user journey, it's as quick as possible, it's as efficient as possible. So there are different ways through which we do this, right? Call it through an application, right? An app, for users who want to download an app. So go to Play Store, whatever app store, download an application, sits in your phone, right? Then we have other users who are like, okay, we don't want to download another app. I don't want this to be another app on my phone, right? So then do, right? Talk about a direct API integration into existing consumer applications. That you already engage with every single day. So if it's your banking partner, insurance partner, logistics partner, for example, right? An existing app seated in your phone for this partner, right? You're able to do a direct API integration into that, so that in terms of the user journey, we do not move away from what you're used to on a daily basis. So every day you access a certain banking service, you know that for you to get access to an emergency service, the process is still the same, right? Still go to your banking app, you'll still get the emergency service there, right? There are those that we believe also don't want that, right? So there's, they want to make a phone call, right? So on the phone call side, we're able to connect you to an IVR, walk you through different options, for medical emergency press days, for security. And then we press that, and then we are able to get now your location based off of the location that you shall have shared from a text that you're going to send you, right? We're also exploring IoTs, wearables, panic buttons, something very simple. Leave it in your wallet, right? So and physical panic button that you can press and get access to the same services and the same response types, right? So these are the different ways through which we as a business are evolving and trying to make sure that our products get in the hands of as many people as possible in the ways that they normally interact with the different applications and consumer facing brands and solutions currently in their own lives, and embed our product and our solution in that journey so that we make sure that it's as seamless as possible, right? So that's how we do it.
Pretty much. This is the last thing that you're going to speak about this morning. And before you clear, I wanted to talk to you about that now. Some of the users you're getting, you used a very nice term that you've gotten a cocktail of users, and that's opening your eyes to actually get used in the country. First thing that I want you to talk to, and you only have 1 minute to talk to about these two issues, is does having a cocktail of users present a bad challenge in your implementation phase? That's number one. And number two, from where you're sitting.
But then Simba's colleague seated somewhere only interact, never uses a bank platform. Maybe they're unbanked. But then they have a mobile, these loan lending applications and services, right? So our solution will essentially fit in that category as well. And not only do we look at this from a scale and usability perspective, but then we also get to understand trends and patterns in how users consume and interact with emergency services. And this puts us in a position whereby we are able to respond to emergencies in a much faster way, and then in terms also of sharing the insights that we have with government and national. So to answer your other question, what the future of Aura currently looks like, I'm seeing Aura being embedded and being a household name and being a solution that is being used by Kenyans from all walks of life in whichever way, shape, or form. Yes. This is going to be something that is going to be massive. It's a solution that is already massive. We're already making impact in the spheres of influence that we're currently in, and this is only going to go higher and higher. So in 2026, the outlook for us is very positive, and we are seeing our product and our solution and users being extended our services and using our services to make and create safer spaces for everyone.
Pretty much. Oof. So the future, according to Victor right there, as you hear, is Aura. So if you want to know exactly what Aura is, just type Aura Kenya, and you go in, and then you will see exactly what it is they want to do in your industry, in your company. I mean, if you work in the emergency, they do not care what industry you work in, because at the end of the day, in one way or another, all of us in our walks of life, doesn't matter where we work, we need an emergency response service next to us in case of an emergency. Two things you can't avoid in this life: emergency and taxes and death. I don't know why they never add emergency in it. Victor, thank you very much for speaking to us.
Thank you, Simba. It's been a pleasure.
It's been a pleasure. All right. That's exactly what we have for you this morning on that conversation that essentially comes from that report of the Auditor General talking about how bad emergency response service is in the country. But Aura Kenya is saying we can reduce it, and we're already making strides towards making it better for every other Kenyan in the country, regardless of where we come from. That's it, what we have for you this morning. I'll step out of the studio. I'll see you tomorrow for another conversation. Good morning and goodbye.